I know what you think this video is about. He's the natural doctor. He's going to tell us about how we shouldn't be drinking coffee and tea. Well, yes, it's been a standard warning in natural medicine since the early 1900s that coffee and tea are stimulants that are bad for your health. People are hesitant to contradict the pioneers of wellness, but I don't have any problem with that. Actually, there are a number of good things that caffeine will do for you. We always knew it gave us energy. We now know that it boosts athletic performance. It decreases our reaction time. It improves abstract reasoning, concentration, and memory. It can actually make us smarter. It would seem like coffee wouldn't even be in the same world with a meditating yogi, would it? The FDA's National Center for Drugs and Biologics lists more than 1,000 brands of over-the-counter medicines that have caffeine as an ingredient. Cold medications, diuretics, pain relievers, diet aids. There are many uses for caffeine. And one of the wildest things that science has turned up recently is the fact that caffeine actually protects you from the coffee that it's in. There are free radicals in coffee that generate free radical production in the body, and caffeine is a potent antioxidant. And it turns out that it will capture these free radicals and prevent damage to soft tissues. All in all, it's a pretty remarkable substance. I've always had a very high tolerance for caffeine. I drank quite a bit of green tea every day for many years. I never drank coffee regularly until I was in my 50s. This is water, by the way. And in recent years, my coffee intake had been creeping up because of social factors and because of my schedule and, well, because I actually enjoyed it. I realized that I was putting away quite a bit when I found out that if I went 12 hours without any, I would start to get a very identifiable headache. So now I had even more incentive to keep drinking it because that headache was terrible. So I started cutting down, thinking that I was tapering well, and then I stopped. 6 o'clock in the morning, I woke up with the mother of all headaches, and I vomited until everything was out of me. I had about 14 hours of headache, chills, sweats, trembling, muscle aches, with dry retching every few hours. And I can't quite say dry because there was a lot of stomach acid coming up. But there's a reason I'm mentioning that, and you'll understand later. I recovered pretty well by the next day, but I surely wasn't myself. And then that night, I was awakened from some really goofy dream by an intense burning in my chest and throat. Why do I have reflux, I thought. So I took one of my favorite remedies for acid reflux. It did nothing. I took some baking soda and water. It also did nothing. Then I drank most of a half pint of milk. No change. So then I panicked. This looked like a heart attack. So I went to the hospital, where my first EKG was normal and a second one was abnormal. The guy told me, "You really timed getting here perfectly," meaning that I was in the process at home, and now I was having the infarct. Inferior wall, he said, that's the best place to have it. So a couple of medications didn't relieve the pain. I was sent up for a heart catheterization. And if you don't know what this is, they slide a tube through an artery all the way from your nether regions up to your heart to look for blockages. When the anesthetic took action, the pain stopped. I thought that was interesting. The cardiologist looked at the screen where I saw my heart beating. That's a weird feeling. And pointed out that all my arteries were large and clear, and I did not have a heart attack. This was not a cardiac event, the cardiologist said. His assistant said, "I would trade arteries with you any day." So I was taken to the cardiac care unit to recover. I told them about the caffeine withdrawal I had gone through and said that the pain must have been due to burning my esophagus by vomiting all that acid. So I was in the CCU for about 9 hours, during which time I had a host of people come in to try to start me on Nexium for my reflux disease. I explained again that I never had reflux, but that didn't seem to register, maybe because almost everyone else does have reflux. But the caffeine withdrawal headache was coming back, and that was a big concern. And within a short time, I was vomiting again. Great. The cardiologist was back with plans to not only give me Nexium, but also metoprolol and lovastatin. After telling me it was a non-cardiac event, now he was saying that I needed a beta blocker and a cholesterol medicine to protect my heart. I said I didn't want to take a beta blocker, and I was lucky enough to have a pharmacologist standing next to my bed. She said he doesn't want the central nervous system side effects. The cardiologist said, there are no CNS effects. He looked at my friend and said, I'm not going to stand here and argue with a pharmacologist. I know what I know. Now, it doesn't take a pharmacologist to know this guy was not being honest. Everybody you know who takes a beta blocker complains about how tired and lousy it makes them feel, and you can just look up the side effects in the PDR. And then I asked what my cholesterol readings were, because I knew they weren't high. He said, it doesn't matter what the numbers are. You need a statin to protect your heart. He must have realized how he sounded, because then he went into what was obviously a practiced script. Well, we're here to help you make choices, not to argue with you. We're all about finding solutions. We're not going to make you take anything you don't want to take. So I was moved to a step-down recovery room, and the nursing staff came in every few hours with all the medications prescribed by the cardiologist in the first place that no one was going to make me take. So I refused them. The nurses were great. In addition to helping me with the nausea, they kept me supplied with ice bags for my head. The cardiologist, for some reason, didn't think I needed any help with that headache. He just wanted to protect my heart, which he said didn't have anything wrong with it. I was visited by another doctor who was more interested in listening to my story, and he said, yes, caffeine withdrawal can cause that kind of chest pain. But unfortunately, he wasn't in charge of my case. He wasn't a cardiologist. They kept me another day and night, and on the following day, I was told I could go home. The cardiologist came in, stood back against the opposite wall, and said, so, you didn't take the meds? All right, you're killing yourself. I'm not responsible. You need those to protect your heart. You are going to have a stroke. You are going to die. You're killing yourself. Can you believe this guy? He wouldn't even glance at my friend the pharmacologist. I just smiled at him. He left in a huff. The nurse practitioner with him looked embarrassed, and I kind of felt sorry for her. I didn't ask him if he himself takes metoprolol and a statin drug to protect his heart. I hope he does. I hope the arrogant windbag takes all his own medicines and feels just as lousy as his patients probably do. But I doubt it. It took another 2 days for the caffeine headache to go away. And I've told you all this to get across 2 points at the same time, maybe more. 1, respect caffeine. Like a lot of other things, it can do good things for you, and it can do bad things to you. It's always a matter of individualization. But I don't think that because it's the second most commonly used product after oil, no kidding, that it isn't potentially trouble. Don't think that because coffee is sold without a prescription, or even caffeine tablets without a prescription, that it can't be as powerful as heroin. I went through all the typical symptoms of opiate withdrawal. So that's one thing. Respect caffeine. 2, respect medical doctors. Most of them really want to do the best job for you, but they have to use the tools that they're given, which manage but don't cure chronic disease for the most part. I'm sure they're frustrated, but like caffeine, they're capable of doing great good and great harm. So as I say, respect them also. A third point, if you'll stay with me for just one more minute, is this. You know how if you go into a corporate restaurant, the hostess greets you with a script? Hi, how are you doing today? And then before you can say anything else, she says, good. The waiter says, I'm Jack, I'll be taking care of you today, and can I get you started with, and then he points out whether they have Coke or Pepsi products. Have you ever noticed they never have both? kind of like the hospital I was in that had Tylenol for pain, but not ibuprofen. Two things are at work here. Everybody's following a script. Nobody cares about how you're doing today. If you want to order then and there, Jack will get ticked off because he's supposed to get your drinks first and then take your order. You're not following the script. You know what I'm talking about, don't you? Now, you might expect that at a chain restaurant, but it's really no different at the hospital where you'd think people would be trying to solve problems. But listening to the patient and formulating a plan based on that person's individual experience is not what they do. After telling them I never had reflux, but vomited for a couple days straight, they wanted to treat me for reflux disease anyway. After my heart checks out clean, they want to put me on a heart protocol anyway because I was in a cardiac unit. I even had the cardiac diet. Don't even get me started about the food. But nobody wanted to help me with the withdrawal symptoms that put me there in the first place. They're just following a script, and I'm supposed to fit it. You know, if you spilled battery acid on your hand and the skin was sloughing off, and you told that to a dermatologist, he wouldn't say, "We're going to start you on this treatment for leprosy." But you tell a cardiologist you have caffeine withdrawal that the medical literature says can cause chest pain, and you vomited acid for hours, he starts treatment for the heart and for reflux. He's going to make you into a heart patient, no matter what your story is. And that's lousy medicine, in my opinion. But I had an interesting realization about all this, and I want to tell you about it. It's in my other video called The Potassium Conspiracy. I hope you'll watch it. Thanks for listening.